start with a nice C-spine AROM assessment just to observe, see what we notice. And then, thank you. And then we're gonna go into our assessment of the movement of the TMJ. All right, Byron, thank you for joining us. So we're gonna be going through a little bit of an assessment before we get into the hands-on treatment portion of things. For the assessment, we're just gonna do an AROM or an active range of motion assessment of the neck. Do you see how his head's already tilted off to one side? Yeah. Yep. Sorry to put you on the spot there with that, but I just had to point it out. An active range of motion assessment of the neck. So essentially, I'm going to just guide you through some motions of the neck, and you're just going to follow my movements. After this assessment, we're going to be doing a assessment of your jaw, which again will just be you're just going to move your jaw. I'm going to observe to see how you move it. For these active assessments, I don't have to place my hands on you. We're just going to be observing how you are moving, and hopefully this will give us information regarding your condition. But there's a chance that you'll notice some discomfort with this, just with general movement. So if you experience discomfort, please let me know. We can modify accordingly. But hopefully it'll give us information about your condition. Do you have any questions about what we're doing so far? Perfect. Do I have your consent to continue? Wonderful. I've already washed my hands. So Byron, I'm gonna get you two nice and gentle. I'll get you to bring your head down as far as you can, all the way, all the way. Good, pain or discomfort with that one. Good, back to center. I'll get you to go ahead and look up towards the sky. Good, and we've got a lovely, did you see that over here? Yeah. I'll get you to go ahead and laterally flex over towards one side, sure. Good, and back to center. We'll go towards the other way. Good, and then I'll get you to rotate towards one side. And again for me. Good, thank you. Back to neutral for me, and then I'll get you to go ahead and turn your head towards the other way. Good, decrease on this side. All right, so I should have asked, is there one side in your jaw that you notice more discomfort than the other? So the side that is restricted in his motion, because that would be preventing him from going as far over in rotation that way, as well as, if you notice, his head is already drifted away from this side here. So we can actually already see how this side here is more dysfunctional. He says he experiences more dysfunction on his side, and that's where we see most of the, well, equal imbalance happening with him. All right, so I'll get you to go ahead and lay facing upwards on the table, if that's okay, please. And still for this one, I'm not going to be placing my hands on you. I'm just going to be sitting here at the head of the table, and I'm going to be instructing you through some motions. Okay, so for this assessment, you're going to want to get down to be able to see the jaw with the nose. What's interesting is I can already see that his head is tilted towards his left side. If you can see that, his nose is not pointed straight up towards the sky. You can see that, right? Yeah. Yeah, you guys can move if you'd like to get better view of things. You guys don't have to all be piled off on one side. As long as I have access to my patient, I'll tell you to move if I need to. Yeah, it's towards this side. Right? Yeah, sure, you might as well do a walkthrough. Let's do a walkthrough so you can see it. One by one, one by one. Good. And when we do the actual range of motion assessment, we're probably gonna have just one camera angle observe the range of motion assessment, okay? What was it, that thing that I was eating earlier? Yeah. Right, so his problem side is his right side. Actually, Byron, can you get your feet to just flat on the table for a second? Yeah, we do have a little bit of an approximation happening through the lower portion of his body. But essentially, you can see how his head is slightly shifted towards his unaffected side, right? So that tells me that likely we're dealing with a lot of tissues being overstretched on this side. Even though the tissues of like the muscular structures are overstretched on this side, I wouldn't be surprised if you might have an actual capsular restriction. My guess, sleeping posture. Do you sleep on this side?
I sleep on my left.
You sleep on your left. Then why do you think this side might be the way it is?
I'm not too sure.
Wait a second, you sleep on your left, small pillow? Like flat pillow?
No, not flat pillow.
Not flat pillow.
Floofer pillow.
It's a floofer pillow. Interesting. Then more questions are necessary in order to find out why is he like that. Another suspicion I might have is you treat dominantly with your right side, correct?
Yes.
Okay, so what do we as practitioners do when we're treating with the one side? There's that pull, right? So that's my suspicion then. If it's not his sleep that's affecting it, it's probably how he practices loading in more on the one side, and he probably is doing a lot of, let me guess, you prefer standing on this side of your patient when you're treating as well too? You're pretty equal on both sides? Okay, because I'm heavily dominant on this side of the table when I'm treating my patients. It's a comfort thing. But
I'm better on this side.
really?
Yeah.
Interesting. Okay, we'll see. But you can see how even just the way somebody does things, just that dropping down of pressure, you can see how that's pulling these tissues in that fascial chain, right? So I'm gonna go wash my hands nice and briefly, and then I'll do the consent for, actually no, I'll do consent for treatment, and then I'll go wash my hands. All right, so I'm gonna go ahead and actually placing my hands for treatment in your upper back area, shoulder area, neck, and around your face and jaw as well too. Purposes of this treatment is to help hopefully treat some of your issues related to your TMJ dysfunction and alleviate some of the discomfort you're experiencing. The treatment itself might be a little bit uncomfortable because we are going to be challenging some uncomfortable tissues. So if it is too much and you need me to stop or change anything, just let me know. And I can alter accordingly. Do you have any questions about what we're going to be doing? All right. And do I have your permission to continue so far? All right. There is going to be a component of our treatment which will require me to actually place a finger on the inside of your cheek area in order to address one of the muscles in your TMJ area. Because it is extremely sensitive and I am on the inside of your jaw, I will need your extra consent in order to do that. And of course, I will establish a pain scale with you, hand signaling system at that time. Is it all right with you if we include that as part of our treatment?
Yeah.
Awesome. Do you have any questions about that? Awesome. Do I still have your consent to continue?
Yes.
Wonderful. I'm gonna go wash my hands. And then can I get you to, if you're okay with it, uncover and just the